Selecting Consultation will open this page, displaying a list of all patients scheduled for consultation. You can use filters to refine the information and locate specific patients as needed. You have the option to choose a specific department or select a particular doctor. Reference ID and QR code can be here. Additionally, you can choose whether you are looking for inpatients or outpatients. Once chosen, the system will display the details of patients falling under these selected categories. You also can customize the information displayed on the screen by clicking and unclicking on these buttons, allowing you to choose which details are visible based on your preferences. Following that, to initiate additional processes, double-click on the patient's row or select the appropriate button. Here, you can access the consultation screen where the details of the patient are displayed. On the right side, you will find two cells where you can specify the patient's blood group and include any additional notes related to the patient. Clicking on the More button provides additional options. By selecting Previous Visits, you can view details of the patient's previous visits. Choose Refer Patient, to refer the patient to another department. Click on Therapist Rating to review the patient's experience with other therapists or add a new rating. Then under Consultation, you have the option to input the patient's present complaints, provisional diagnosis, prakriti, and comorbidities in these fields. You can choose the head therapist and any additional therapists from these sections. While choosing food items, use the drop-down list and you can also select relevant tags. If multiple tags are needed, click the Search button and select multiple tags or search for them. To add a new tag, click the plus tag icon and create a new one. Enter the soap details in this section. On the grid on the right side, you can observe the patient's treatment name along with its count. To save it, click the Save button or Print by clicking Print. Click on History under the Consultation tab to add the patient's previous diseases and conditions. Begin by entering the history of the present illness in this section. Subsequently, click on the check boxes that correspond to the diseases the patient has had in the past. If there is a history of any of these diseases in the family, you can note it here. Subsequently, enter any past treatment details if applicable. For female patients, enter the details in this section. Choose the menstrual cycle type from the drop-down list and mark the check boxes corresponding to the associated problems. Subsequently, input details such as menarche, menstrual flow, LMP, menopause details, and any complications associated with delivery, if applicable. In the Personal History section, provide details such as appetite, sleep patterns, bowel, micturition, stress levels, diet, and occupation if needed and fill in by using this slider. Enter details for allergies and habits in these sections. Finally, click the Save button. To input general examination details for the patient, navigate to the General Examinations section under the Consultation tab. Check the following check boxes corresponding to the symptoms experienced by the patient. Enter essential details, including blood pressure, temperature, and consciousness level. Entering height and weight will calculate BMI in this section. To get a fat analysis, click on this button. Now enter waist size and growth assessment. Choose the nutritional screening and build from their respective drop-down lists. Provide information regarding weight gain or loss in last 6 months, psychosocial assessment, orientation, SpO2, mobility, pulse. Tick the relevant checkbox which are needed. Fill heart rate, others, gastric issues in last 6 months, gait. Tick the relevant plan of healthcare that's going to be taken. Fill these details as needed. Select the picture that best represents the patient's current pain state. Then click this Save or Print button. Click here to go to the Systemic Examination Investigations. Under the Systemic Examination Investigation section, fill the details of the patient such as for respiratory system, cardiovascular system, musculoskeletal system, neurosystem, GI system, skin, urogenital system, gynecological system, pediatric system, investigations, and diagnosis which will automatically come if filled in consultation. For other cases like psychosocial, antenatal, postnatal, and pediatric, tick the corresponding checkbox. Click on the plus sign button to add more details about each case. In the Ayurvedic profile section, you can input various details. Enter Ashtastana Pariksha details, followed by Dahavidha Pariksha. Additionally, provide information on Panchanidanam and Samprapti Ghataka.